Good morning, everyone. I'm Riley King, and welcome to my morning news report right here on the Riley King Network. Let's begin. Health officials await test results on two potential New Hampshire coronavirus cases. Patient at Littleton Regional Hospital doing well, doctors say. New Hampshire health officials are waiting for test results to determine whether two people in the state have a coronavirus that has been linked to more than 100 deaths. Officials said the two recently traveled to Wuhan, China, the epicenter of the novel coronavirus outbreak. They reported mild symptoms that could be caused by the virus and say they have been placed in isolation while tests are done. The World Health Organization has increased the risk level of the virus to high, with confirmed cases in nearly 24 places around the world. The Center for Disease Control and Prevention announced that 20 U.S. airports, including Boston Logan International Airport, will screen passengers for the illness. In New Hampshire, one of the patients in the isolation room at Littleton Regional Hospital is a 19-year-old man who was in Wuhan on January 6th. Doctors at Littleton Regional Healthcare said he is doing well, and if not for his recent travel, he would have been treated and released. As of this moment, this case is still a suspected case, said Robert Nutter, President and CEO of Littleton Regional Healthcare. The patient is an international student at White Mountain School in Bethlehem, New Hampshire. School officials said he was in the Hubei province of China from December 21st to January 5th. Officials said he was home during winter break, but is not from Wuhan, China. Hospital officials said the man came down with mild respiratory issues after returning to New Hampshire and immediately called for help. He was admitted to the hospital Thursday as a precaution. We were concerned about him because of his travel history and his symptoms, kind of pointed to a suspected case of this coronavirus, Nutter said. Those symptoms, including a fever, were mild. He had what would be considered by the general public almost a bad cold, said Dr. Ed Duffy, Chief Medical Officer at Littleton Regional Healthcare. School officials said no one else on campus has reported any symptoms associated with coronavirus. The patient has been placed in a negative pressure room, Duffy said. A negative pressure room is a room that, when the door opens, air rushes in. It does not go out, Duffy said. So, any respiratory droplets or the air in the room does not mix with the general air. Hospital officials said members of the staff who deal with the patient are protected with special gowns and masks, but the patient didn't require much in the way of treatment. He didn't require oxygen, Duffy said. He didn't require any medication. He didn't require any other respiratory therapy at all. Hospital officials said the community's safety is a prominent concern, and there's little to worry about in this case. The community and visitors to our facility have been at virtually zero risk of contracting this disease from him, Duffy said. Duffy said other common illnesses are more of a threat to Granite Staters. Influenza still remains a far more virulent, a far more dangerous threat to our communities at this point, he said. State health officials have released little information about the other patient, including where the person is being treated. A call is scheduled for Wednesday at noon with healthcare providers to address the coronavirus. Officials said the person recently traveled to China and is being kept in isolation. If tests show that either patient has novel coronavirus, more information will be released, officials said. The CDC has reported 5 confirmed cases of the virus in the United States, while China has reported more than 4,500 cases. A level 3 travel advisory was issued late Monday night, urging Americans to postpone any travel to China, with a heightened advisory for the affected areas in China, meaning Americans should not travel there at this time. Right now, there is no spread of this virus in our communities here at home, said CDC Director Robert Redfield. This is why our current assessment is that the immediate health risk of this new virus to the general public is low in our nation. Health officials said the number could change in the coming days, but the goal is to contain the virus and stop it from spreading. That's it for my morning news report right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another news report. Goodbye, everyone.